You have so much to share. You've brought a method with you. You want to share it with people because it can help so many. You are a holistic therapist and above all, as I understand you, a healer of the new era.
Hello, Britta. It's wonderful to be here. Thank you for the invitation. And yes, I think the topic is very interesting.
Now, of course, we want to know osteomodulation. Yes, it has something to do with bones. That should also be the overarching theme for this program. The bone, so to speak, the still unknown reflex organ. You say you can even straighten bent bones again. Small bones, large bones all over the body. Starting from the head and jaw, down the spine, all the way to the feet. How do you do that?
So you asked how this came about. Osteomodulation actually originated from modulation itself. And modulation is a three-dimensional gripping system. Essentially a gripping technique where you don't go very deep into the tissue, or not all at once, but rather you always go to where the adhesions, hardenings and tensions are, where the scars are, and that you essentially layer by layer in a three-dimensional movement. I always say you harvest the hardenings or adhesions. So I go exactly to where I find and reach it. And there I can resolve things very quickly. I don't think that's possible with other methods. Honestly, I don't know anything comparable. It works so quickly, sometimes so fast that people often feel almost dizzy. Because the meridian system, it's all about flow. When an adhesion is released, the flow increases, becomes better, because the adhesion slows everything down. Yes, everything. It sticks everything together, holds it back. And suddenly the flow returns, and it happens so quickly that people actually become quite dizzy. Because the meridian system simply can't balance itself out that fast, even though it only lasts a few minutes each time. It keeps coming back. But then they get glassy eyes, and when you work like this, often you hear cracks and pops, and you notice crack, crack, crack. It all happens incredibly fast. And the special thing about it, hence the osteomodulation, is that I can also work within the bone. I can't do that in 2 dimensions. I've tried it, it doesn't work. It only works with this method. And even if you're not too deep or not too shallow, but exactly at the right point, it's really about the point, and that's a matter of intuition. That's why it's so much about working with your hands, if not entirely so. It's so important so that I can truly sense 100% what needs to be done and where it needs to be done. And in the Schneider method, there are no fixed grips, only principles. A fixed grip would make all of this impossible. Everything happens so quickly, I would have to learn 100,000 different grips, and I never know how it will resolve itself. Every adhesion releases differently and is structured differently. That means I always have to be a bit like a violinist. I have to create every note anew, so to speak. And that's why there is only one principle. There isn't a single fixed grip, because that would simply be pointless. And osteomodulation only came about a few years after I had already been treating soft tissues, connective tissue, fascia, muscles, and all the tendons. Suddenly, I always had the feeling that when I touched the bone, when I touched the knee, I noticed they were too cold, too hard. Something wasn't right.
With other bones, I often thought there was something off. And for me, it's always like this. I can feel it. It doesn't fit, and eventually there comes an event where it finally works. And for me, with osteomodulation, it was already in my mind long before. But I don't know exactly when it started. But when I then got into the depths, into the thick bones, a young woman came in, around her mid-20s or so, and she said she wanted to have children. But she had fractured her pelvis in 3 places, both pubic bones and 1 ischium. A car had hit her abdomen while she was standing without any organ injury. You really have to imagine that. It's almost unimaginable. And I knew that she needed help. It felt like an inspiration. I had to find something. And with her, I learned how to work with larger bones as well, like the ilium, pubic bone, ischium, knee, and elbow, how to access them. That's not always easy. Sometimes it's quite hard work, and sometimes it goes relatively smoothly, so you can't make a general statement about it. When I manage it, then I've achieved a breakthrough. And we've already talked about the head, talked about the jaw.
I need that everywhere. I need this osteomodulation a great deal. And many issues are actually superficial in the soft tissue area, muscles, and in the bones. And the bone is also such a powerful reflex organ because energy flows through the bone just the same. I've just received a hint about bone tension, relaxation, or compression coverage. Compression, that so-called piezo energy, is released there. I've only just heard about that. I'm not familiar with it yet, but it makes things interesting somehow. Maybe at home, maybe it's somehow connected to that. In any case, especially with head injuries, when the skull becomes hardened, whether from a blow, either from a clearly visible injury or just from trauma, the energy flow simply decreases. And you can always say that that's why With chronic issues, you should always take a look at the bones as well. A very interesting topic is the ilium, because the bone is, on the one hand, an organ for treatment. If the bone is in alignment, then you can also adjust the surrounding muscles. But I keep experiencing that, especially women often have bladder problems or issues in the lower abdomen. Some also have a strangely smelling discharge. People call it fishing, something unpleasant, but that's just part of it as well. Or they also have issues with digestion and stool. They have problems in these areas. And with those patients, when I take a closer look, there are often significant hardenings or even deformations in this area or that area. There are real tension patterns and hardenings present. That's what happens. And when I release that, all of a sudden I notice a small movement occurs. And then it opens up and essentially returns to its original correct shape again.
That means such hardened areas on the bones have an impact on the surrounding tissue.
Every bone has an effect on its surroundings. That is the correct way to put it. And the pubic bone plays a major role in issues related to the lower abdomen. Sometimes the ischium as well, but it is less frequently involved. It is more often involved in the sacrum or in other issues. But it can also be involved sometimes. It does happen.
What does stage fright have to do with the bones? You mentioned that as a keyword to me on the phone, and now I have to follow up on that. I am a trained actress and have also been working as a presenter for a long time, and I know how many people suffer terribly from stage fright.
Stage fright certainly has many faces, I would say. But I experienced a very interesting story in Salzburg. Salzburg is a city of music, and there I had a female musician from every major Salzburg orchestra, an Italian, told me in her beautiful Italian, or rather Italian-German, that she simply has a problem. She experiences incredible stress when playing and suffers from severe stage fright. And then I asked her if she had always had this, and she said no. No, in the past I would look through the sheet 3 times and already grasp the essentials. So in fact she almost had a photographic memory, and then we tested that as well. And then it turned out that as a child she once fell on her face. Then we worked through that, but that still wasn't it. That did make a bit of a difference. Then we got to when she was 15 or 16, and that's when she really fell onto the street. She injured her eye there, specifically the upper edge of her eye. Then I worked through the whole thing. Back then I was already fairly skilled in bone work. Then I noticed that her eye socket had shifted a bit and also compressed. Now it had actually peeled away. That was actually the stage fright. It had actually peeled away. I had to use a lot of concentration so that she could even see the notes correctly. And this stress of seeing properly was what caused her stage fright. Because if you have to force yourself to tremble like that artificially, it can collapse at any moment. Or it might happen that you can't make it through an entire piece, and that's what caused the stage fright. And then I have this compression here. And that's also interesting. You can take cells that have been compressed together. It's like a crumple zone in a car where the metal folds in on itself and the bones are pushed together like that. You can actually work them back into their original shape. Then we also have the eye socket. I actually don't remember down there anymore. I think I also worked on the lower part on that thing. In any case, I just kept going until the eye socket was relaxed and back in the right position. That's important too. Having the right position but under tension doesn't help at all. But then it was truly relaxed. Both eyes were looking straight ahead in a relaxed way. And then she called me and said, "Thank you. We're done. I can play completely normally again." So being cross-eyed can also be connected to that. Because I had also played a little myself. I experienced this with another woman as well. With friends of ours, he really had it from a fall. The bone cells were actually pushed together like that. It honestly almost felt like metal being pressed together. It even created waves. And then I worked that back as well. And then the cross-eyedness was gone. I said this is the first time in a long while that she has no stress and no pressure, and that she can simply look around in a relaxed way. That took many years. Yes.
There are just so incredibly many invasive procedures on joints nowadays. People are so quickly advised, oh, then let's just do surgery. I've done that so many times already. We just do a minor procedure. And afterwards, everything is worse than before. And with your method, you could actually fix that. That's exactly why we do these shows, to send this information, this knowledge,
possibility,
out into the world. And at this point, it occurs to me, how can people find you? How can they reach you?
I have the website schneidermethode.com for those who want to learn it, gerhardschneider.at for those seeking help, the YouTube channel schneidermethode.at or Instagram. Exactly, that's how you can find me. You mentioned earlier that joints can already be a bit crunchy in adulthood, but we actually haven't addressed that yet. That
is exactly what I was about to ask next. I find it fascinating how something like that is even possible.
That is indeed interesting. I actually realized it when I had a woman as a client who had issues in her right lower leg, specifically her ankle. Yes. Bone marrow inflammation, and the joint was stiff. And because she couldn't roll her foot there, her knee eventually got damaged, since she compensated for everything with alternative movements using her left knee. And then I already had a surgery appointment, but she said, actually, I don't want to go through with it. So I asked, should we give it a try? I honestly didn't know if it would work, but should we give it a try? In my experience, I've always tried. And by trying, you find out whether it works or not. But first, I had to get her ankle to a point where she could at least roll her foot a little. That was also interesting, especially regarding two-dimensionality and three-dimensionality. I ended up hurting her quite a bit because there was no other way. Everything was so dry and stuck together and all that. Ah, she said, the masseur did that too. And I asked, did it help at all? She said, no, she only had the pain. You can't achieve that in 2 dimensions. It simply doesn't work. Then I used the 3-dimensional method, and she experienced about the same pain. But already by the 2nd or 3rd time, you can hold back a little. And that was the beginning when I started working on the knee, because I said there's no point in treating the knee if we can't resolve the other issue, since you'll just end up with the same overload again. And then once we got the ankle, let's say, reasonably sorted so that it functioned at least halfway, the whole thing still didn't work out. There was simply too much damage. That also needs to be said. And then I started to address the knee, and now I need to explain what makes up the bone. We all know trees. We are all familiar with trees. And I always say the bone is like the wood. And when I have a tree, whether it's a young tree or even an older, healthy tree, it is always flexible. That means the bone must be dynamic. People always say you need hard bones, but that's nonsense. What we really need are strong bones that meet our needs, but it also has to be something dynamic. And it's precisely the fresh green wood that is flexible, so to speak. That's where everything grows, everything is alive, everything works. And anyone who works with wood knows that wood can reach a state where everything becomes so dry you can hardly chop into it with an axe anymore. It's that transitional phase where it starts to die off. And if it continues, it basically turns into brittle wood, or in the case of bones, into osteoporosis. And even from osteoporosis, you can return to the green, vibrant state if all the surrounding conditions are right. It's a bit more difficult, but it is possible, at least sometimes. But from this dry state, back to the green state of vitality, almost never, but very often it doesn't happen. And that's what I managed to achieve with this woman. Every time I worked with her several times because she had a lot going on. She was completely new to me. We didn't have to work through everything from her childhood, all those injuries and everything else that comes up. And then I made the bone elastic here. And when you get to that point, it's not enough for it to become dynamic in just one direction. It has to be dynamic in all directions holistically. And as it gradually moved more and more toward that point, suddenly she said, I have no more pain. After 3 to 4 treatments, she said, I have no more pain. Then I continued the treatment a bit further. And over the next year, every few months, we did follow-up sessions, adjusting the neck a little, then treating the knee as well, making sure everything stayed in a good flow, that it remained elastically balanced, so to speak. And then I said, you know what, go and get an X-ray. I agreed to it, the X-ray. I wanted to know because she had grade 4, that means no cartilage left. And in medicine, that means when the cartilage, if there is no cartilage, then none will grow back. And that's what I wanted to know, because without cartilage, I don't accept pain. That doesn't exist. That's not possible. And then she came back and said she was at 2.5, and she was a retiree. She doesn't need to become a world champion anymore. And for what she needed, the cartilage was sufficient. For peak performance, it might have been too little, but for younger people, they were already around 65, 70, so not exactly young anymore. And with younger people, you can get it back into an even better condition because their entire metabolism is more vibrant. So with an athlete, you would probably be able to restore it as well. In 3 or 4, in 1 or 2, those are the best conditions.
Gerhard, what is happening there? Where does this cartilage come from? You send an information ahead. Hans, the brain, so that it says it will regenerate there again.
Callus. Yes, it is indeed connected to the brain as well. The position has to be local, it has to be correct. Metabolism only works when it is dynamic. That's why these stages from green wood to dry wood, at that point, metabolism stops. And what I do is essentially work the cells back into this. There are also adhesions in the bone. It's the same as in the skin. The bone is porous, blood gets in, serum gets in, inflammatory substances get in, and they stick together. And when I pull the cells apart again, so to speak, tear them apart, break up the adhesions, then it becomes elastic again. Then this healthy metabolism starts up again. The brain also notices, now I can do it again. Before I wanted to, but I couldn't anymore. Of course, all of this is interconnected on these levels.
Fantastic. How long does it last? Can it last forever?
Yes, let's put it this way, if you maintain a normally healthy diet, or, as with the woman who addresses the root causes, we have actually resolved the root cause of this overload, then it can last a lifetime. Of course, it depends. If you become overloaded again, if you eat poorly, become highly acidified, or put yourself under too much strain, naturally, it can regress. But I always recommend to people, at the very least, once or twice a year, do a little follow-up work. That's often enough to keep everything going. And if a bit more comes up, then maybe you just do it 4 times a year or so. But the effort involved really isn't excessive.
There is nothing comparable in this field. It also works completely differently from massage or osteopathy. When osteopathy is done well, it can be very helpful. It's holistic as well. But what you do, that's really next level. Yes.
It's just completely different somehow. I don't know osteopathy myself, but my clients have always told me that what you do goes deeper, it goes further.
What you do?
That's the information I've received. That
is wonderful. And maybe there are also exceptions, people for whom it doesn't work, maybe for psychological reasons as well.
Emotionally, that is, states of tension. There are emotionally both fixed issues and flexible ones. There are certain issues where the body says, until you resolve this issue, I won't let you move forward. Whether it's some kind of mental story or a matter of hierarchy, it doesn't matter. These are such compelling connections. And then there are also the flexible ones where you can resolve issues and then things become easier because very often it's connected to a certain topic, not always, but very often. And when people truly resolve it, things improve. But it can also work without that. So sometimes it works even without addressing it. There are these different variations.
I have another keyword for you regarding the bones, just to wrap this up. You can even straighten bent bones.
How
do you do that?
Bent? Are they really? As I said about the injury, I already mentioned that at the beginning. Then they are bent and compressed. With the jaw, it is often a long-standing misalignment. Let's take a look. In another video, I already mentioned if the jaw is crooked, then the lower jaw always has to adapt to it. Then the angle changes a bit, so I have to make the cells elastic again and also work on them in such a way that the angle becomes harmonious again. That often works in just one session. Maybe not always, but it does work quite often. Collarbones are often bent due to injuries. What I once experienced, I had someone who got hit by an unexpected hook. He had an angle, basically an extra angle because the keel was broken. I managed to straighten that out again, but don't ask me how. It was so exhausting that I myself was actually completely wiped out. In fact, by the end, I didn't really notice exactly what was happening anymore. I think I was just running on autopilot at that point, but I managed to do it. The jaw was back to normal. But those are just things that happen. At that point, you can't control it anymore.
I'm so grateful that you are here and sharing your valuable knowledge with us, and above all, that you also pass it on. That you train people who may already have a background in physiotherapy, but also people who...
Big debates.
Even doctors? That would, of course, be the most wonderful thing of all.
For people who work with their hands. You have to enjoy working hands-on, you need to have a feel for it and want to develop that sense. After all, it can be learned.
How long does such a training take?
So, in my case at the moment, I focus on everything around anatomy, but I don't actually teach that myself. People have to learn that elsewhere. That's why they already come with some training. Then I offer 3 sessions of 3 days each for learning the fundamentals. And after that, it continues with topic-specific workshops and the outcomes, which also arise from the needs. There are always people who say, yes, I know I can work 3-dimensionally, but here I get stuck and there I get stuck. And when a few people come together with similar challenges, we create topic-specific workshops tailored exactly to those areas. Because it's one thing to learn the basics and you can already achieve a lot with that. And then there are those topics where you really have to dive deep. And that's exactly what the workshops are for.
And did I understand that correctly? So if I observe older people and I notice this stiffness and that their head is no longer flexible, that this whole level isn't functioning as well anymore, can you help with that?
Yes, I can help with that as well. In those cases, it often also depends on living the right lifestyle. I wrote a book about it.
Did you write? Yes?
I wrote it.
What is the name of the book?
Goodbye Pain.
Goodbye Pain.
Live pain-free with the right posture. And I wrote a lot of things in there that help people incredibly. Firstly, the book, or rather this knowledge, is important, ideally from the book, of course, to avoid this altogether, but also to be able to have a therapeutic effect. Because when I keep seeing the same cases over and over again, I experience this often at the beginning, which is why I wrote the book. You do a treatment to release the neck. They go back, sleep incorrectly again, or sit incorrectly. There's also this slouching position and a sitting position. Yes, then it comes back again. I always compare it to a shoe. If I put on a tight shoe and go to therapy and everything is fine afterwards, then now I put the tight shoe back on, then I have the same problem again. It's exactly the same with lying down and sitting, with all of that. If I always do the same thing, I can't expect to get different results. Exactly.
Wonderful. Dear Gerhard, it's wonderful to have you with us. What you have created is truly a gift to the world. Thank you, dear Gerhard Schneider.
Thank you very much for being here.